John, you gave us a great example a moment ago of something sinister that you kept your mind open to, and it led you into the proper direction of referral on for further workup. But you also mentioned the yellow flags. So, in the absence of sinister pathology or progressive neurological deficits or other things that would tell us, okay, this is a safety issue, this is a red flag, when we do see that, okay, this patient's certainly appropriate and safe. However, there are some barriers here. Do you have a patient example perhaps that might illustrate how you'd handle that, how we as physical therapists could effectively handle those issues in primary care?
Absolutely. So I think I'll use a couple of examples that aren't mine, and then maybe give you an example. So I remember, so Mark Miller and Scott Herbawi, again, kind of my core trainers. I've been taught by other McKenzie faculty, but Mark always talks about, hey, listen, you got some yellow flags. Let's say you have somebody that's really wrapped up in the medical system. They've got a lot of hesitancy. They're very concerned. They've got a lot of people telling them a lot of different things. They're not really confident that they can get better. Mark's always said, hey, listen, you might have an appointment where you're just going to talk and try to build some rapport. I've seen Scott do that. I think he might have got on me, frankly, in the residency, because I was so interested in a mechanical examination. He's pulled me out of the office. It's like, what are you doing, man? This person's not ready for it. So I think, and I've certainly done that, in the military, just trying to build some rapport. I mean, one of the things, my rank as a lieutenant colonel, there's not a whole lot of people that come into my office that outrank me. So my primary concern is always building rapport immediately and being monitored. So back to that question is, are you monitoring that if it's a yellow flag? Because you don't want that yellow to be a red flag, right? So stay on top of that, because it's an honor, as we all know, it's an honor to treat patients and help them through whatever they're going through. And maybe that patient that day is going to be willing to have an exam, and the therapist in primary care needs to recognize that and say, it's okay. I mean, I had a patient just the other day who did outrank me, but I had to sit there and go, you're doing great. And this is why you're doing great. Because this particular patient wanted things to go quicker than they could go. So, no yellow flags, but I certainly, wanted to maintain the motivation and the trust that I had with that patient. So I think in primary care, certainly, I mean, look, nobody goes to the primary care doctor because they're having a good day. And they're not going to the physical therapist because they're having a good day. So I think we need to remember that about these yellow flags, and not judge those. For example, it's very easy to go, you know what, this patient's not going to be interested, or they don't care, and I'm not going to care more about it than they care. But I think we need to be cautious of that, because maybe they need you to say the right word to be receptive to physical therapy and addressing this issue that you can address. We certainly don't want to lose an opportunity.
Mm-hmm. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.